All right, let's get you ready for your exams. Today, we're tackling one of the most important topics you'll face, burns. We're going to break it down so you know exactly what to look for when you see those questions. So let's start with a puzzle, one that might just show up on your test. How is it possible for a burn that hurts less to actually be more dangerous? Keep that question in the back of your mind. The answer is a critical piece of nursing knowledge. First up, the absolute basics. What are we even talking about? A burn is simply an injury to the skin, and maybe deeper tissues, caused by things like heat, chemicals, or even radiation. It's a fundamental definition you've got to know. And just so you know, all the key points we're covering today are pulled directly from this excellent nursing overview. We've just laid it all out for you, nice and simple. Okay, here's the core of what you'll be tested on. Let's compare the 3 degrees of burns side by side. Knowing the difference between them is absolutely essential. Take a look at this chart. First degree is superficial, just the top layer of skin. Think a basic sunburn. It's red and painful. Second degree goes deeper, affecting the epidermis and dermis, and you'll see redness, swelling, and blisters. Now look at third degree. It goes through all the skin layers, sometimes even deeper, but check out that pain level. It says no pain. That's the key right there. Here's your first big exam tip. If a test question mentions blisters, your brain should immediately lock on to second-degree burn. Blisters are the classic telltale sign. Don't forget that. And here it is, the answer to our question from the beginning. Why no pain? Because a third-degree burn is so deep, it has literally destroyed the nerve endings. The fact that the patient can't feel pain is a sign of incredibly severe full-thickness damage. All right, so you've identified the burn. Now what do? Let's talk about our nursing priorities, starting with the key nursing diagnoses you need to have ready. These are your top 5. Impaired skin integrity is obvious, right? But the 2 you really need to worry about are risk for infection, because that protective skin barrier is gone, and risk for fluid volume deficit. Severe burns cause massive fluid loss, which can lead to shock. These diagnoses are what guide every action you take. So, with those diagnoses in mind, let's look at how we match the treatment to the specific type of burn. For a first-degree burn, treatment is all about comfort. We're talking cool water, not ice, some basic pain relief, and maybe some aloe vera to soothe the skin. Simple. With second-degree burns, our big concern is preventing infection. So, treatment steps up. It's all about gentle wound cleaning, applying a proper burn cream, and of course, managing that pain. Now, third-degree burns, this is a whole different level. This is a medical emergency. The top priorities are getting IV fluids in immediately to fight off shock, starting antibiotics, and preparing for surgery, like a skin graft. It's a systemic, all-hands-on-deck situation. I know that was a lot of information, so let's wrap up with a super easy memory trick that will help this all stick in your head during the exam. Just remember the 3 B's. First degree has basic redness. Second degree has blisters. And third degree goes beyond the skin. That's it. Basic redness, blisters, beyond the skin. It's a simple way to keep them straight when you're under pressure. So I'll leave you with one last thing to think about. You know how to identify the burn. You know the treatments. But for any severe burn case, what is your absolute first action as a nurse? Before you do anything else, what's your #1 priority? Think back to your fundamentals. Good luck on your exams.